most of the time students are planning surveys and other types of research, and sometimes they are confused which type of study design will be used. So this lecture will help them choosing the appropriate study design. Another objective of this lecture is to understand the concepts of different study design. And to learn about the advantages and disadvantages of several study designs. I hope you all are listening patiently and my voice is clear to you. And if there is anything, is it all okay? Right. Okay. Because of some, I think, global internet glitch, and there was some hiccups in the lecture, but I hope the lecture will flow smoothly from now onwards. So before going to discuss the study design, we should know what is epidemiology. This may be something that you already know, but a recap would be good. So epidemiology is the study of distribution, determinants, and dynamics of disease within the population. And we understand that epi is to upon, and the demos are the people, and logos is the study. So studying the people, the disease distribution, and the factors affecting those diseases or health conditions, and the dynamics is all included in the definition of epidemiology. So one thing that's more important to understand here is epidemiology is not only concerned with the disease, but any health condition. And so similarly, it not only refers to the diseased people, but also the healthy people. So whenever a researcher wants to conduct a study, there may be one objective to a single objective to study in that project, or maybe a couple of objectives, or maybe multiple objectives. Most of the time, all of those objectives can be classified into two major types. One is to find out or prove the researcher's hypothesis, or the other type of objective would be to find out the frequency of condition or an event. For example, if a researcher is not sure the treatment A or the treatment B, which one is better, and the researcher wants to compare those two treatments, that type of research objective would be assessing the hypothesis, which one is better. The next type of objective in most of the research studies people conduct is to just simply find out the frequency of some health-related condition. Frequency of some health-related condition means how many children are there in Karachi who are affected by COVID-19 since January 2020 till December 2020. So this would be just a simple study in which we are going to find out the proportion of children in Karachi who are affected by COVID-19. So we are just finding out the frequency. And maybe in the end, we can just tell the world that we found out 20% of the children were affected by COVID-19. Out of those 20%, these many were boys, these many were girls, and so on. So here, the point I would like to make is researchers may have two main objectives by doing some research study. One objective is to find out the frequency, that is called the descriptive epidemiology. The other type of objective is to prove or to assess the hypothesis, that's called analytical epidemiology. And sometimes some more ambitious researchers, they do both of the objective in one single study. That can be done, but that may be a more difficult task because of the overwhelming work to fulfill. So whenever we try to prove some relationship hypothesis, there would be some cause, the risk factor, and there would be some outcome, the effect. Effect may be considered as disease. That means there is a cause and effect relationship, cause to effect. The cause, the risk factor is causing the disease. This relationship, if someone studies this relationship, that would be considered as analytical epidemiology. So descriptive epidemiology seeks to measure the frequency in which disease occur or collect descriptive data on possible causal factors, while analytical epidemiology attempts to specify in more details the causes of a particular disease. So broadly speaking, we classify the epidemiological study designs into observational studies, in which the researcher just observe and do not intervene. Other types of studies would be experimental studies. Another method to classify the epidemiological study design would be descriptive studies and analytical studies. So we'll see in the later slides. Are the types of studies in which the researcher intervene into the study. By intervention, I mean here is the researcher manipulate the patient's condition with the help of some drug or a vaccine or some educational intervention or maybe some other strategy or surgical technique. These type of studies in which a researcher knowingly manipulate the patient's condition under study are called experimental studies. While those studies in which the researcher's role is just to observe and knowingly do not intervene, that's called observational studies. The experimental studies may be pure 100% experiments. Those are called RCTs. We'll see in the later slides what RCT means. RCT means randomized controlled trials. Randomized controlled trials means RCT. Randomization means that whatever the chosen group we have on which we have to conduct the experiment, we will provide equal opportunity to everyone to get selected for the drug of choice that we are going to give them. Because, for example, if we are having 100 people, 100 volunteers who are agreed to take part in our research, in our experiment, half of them will receive the experimental drug and half of them will not receive any drug or maybe may receive some placebo. So in that situation, we have to take consent from all the 100 people that they may receive the active drug or maybe the placebo. And we'll use some computer programs or some other random number tables through which we allocate the active drug to 50 of the participants out of those 100. Those 50, who will be those 50 participants? We don't know. This is not our choice. This is purely random allocation by the computer programs or some other methods. In this manner, this experiment will be labeled as a true experiment or a complete experiment. In case where we fail to conduct the randomization, for example, we are having 100 people and we have make 50 people to group, and we have made the groups on the basis of our own choice. We preferred the younger people in one group and the older people in another group, or maybe our friends in one group and the not our friends in other group. That's a kind of bias, and that's not a random sampling, and that's not a randomization. If randomization is not practiced, that experiment will not be a true experiment. That would be considered as a quasi-experiment, or maybe a flawed experiment. So whatever study design you choose, your study design must be free from biases, must have good internal validity. Good internal validity means your methods are good. For example, if you want to find out the anemia in your patients or participants, you will use very good, reliable, accurate, authentic methods to assess the hemoglobin level and anemia in your participants. If you are assessing the anemia based on just clinical observation of conjunctiva or palms, that may be a clinical method, but not an authentic method, and your internal validity of the research may be compromised. So based on your resources and budget, you use good methods to enhance your internal validity. Once your internal validity is good, your results can be extrapolated or can be applied to the outer world where you want to make some conclusions. So in simple terms, as I said before, study designs can be classified broadly into descriptive studies and analytical studies. By descriptive study, we mean that where we don't make comparisons, we just make descriptions based on the available patients or participants. Those participants may be a group of people having similar conditions. For example, you are posted in a COVID-19 ward, and you observe that, you notice that there are 30-40 patients who are on ventilator support, and all of them were affected by COVID-19. So you wrote a case series based on their characteristics. What were their age? What was their sex? What was their comorbidities, COVID-19 related parameters, and other conditions on those 30, 40, or maybe 100 cases of similar sort. That kind of study design is classified as case series, because this type of study design is based on just cases of similar sort, and you don't have a compare group, so you label it as case series, and you just have descriptive data to present here. One of the most popular case series, or you can say case report maybe, from the history is about the disease which today we know as AIDS, or in its initial days we know it as HIV infection. Not all HIV infections are AIDS, but all AIDS patients are HIV infected. So this was the study which was published in 1981, December 10, 1981, by a group of researchers who observed that a couple of young male patients came to their clinic with similar conditions. those similar conditions or problems were, they all had pneumocystis carinii pneumonia. They all had mucosal candidiasis. They all were homosexual. And they all had some cellular immunodeficiency. CD4 cell count was low. All of them had Kaposi sarcoma. So this was a very peculiar condition because Kaposi sarcoma is not a common finding. It may occur without HIV and AIDS, but most of the time Kaposi sarcoma doesn't found commonly in the clinics. But if 4 men with similar condition and similar behaviors, homosexuals, they were found with Kaposi sarcoma, it was an alarming situation. And from that moment, we came to know bit by bit about the HIV and the AIDS thing. At that moment, those researchers didn't label the infection as AIDS or HIV. They just label it as an acquired cellular immunodeficiency disease. So you must have, you can notice what's the problem with these pretty looking children, these pretty children. Their limbs are malformed. And the first child is having some gadget in his on his hand, which enable him to grasp the pencil to write. This condition is called phocomelia. And the extreme condition of this disease is amelia, absence of limb, or deformed limb is phocomelia. This disease may occur congenitally by birth for different reasons. But in 1950s, 60s, all over the world, there was a drug which was used for morning sickness by the pregnant ladies, which the name of the drug was thalidomide. Most of the women who consumed that thalidomide during pregnancy, their children born with some congenital malformation, phocomelia or amelia, and some had stillbirths or abortions. A researcher wrote a very descriptive, lengthy report on the birth of these children in Germany, and it was considered as a very good case series on these children. So this was the condition, phocomelia amelia. So case series is something where you don't have the denominator, you just have the cases. You don't know where those cases are coming from, out of how many in population those cases were. You just have the numbers who are affected. But in the cross-sectional studies, you must have the denominator. You must have a defined population from where you are getting the your study participants. So in the cross-sectional study, we study the disease and its risk factor at the same time. Because we are studying the disease and its risk factor at the same time, we cannot make sense that which is causing what. It may seem illogical because, but in the cross-sectional studies, if someone presents to you with hypertension and diabetes, can you make sure that which disease causes what? Is the hypertension is the reason of his diabetes, or the diabetes is the reason of his hypertension? Because you don't have the data over the time. You just have the data at the one point, at one cross-section of the time, just now. So because of this problem, cross-sectional studies cannot make temporal relationship. These are the drawbacks of cross-sectional studies. For example, in this picture, a very panicky driver has hit the signal post, traffic signal post, and the traffic signal post is out of order. What could be the reason? Is the reason of this signal post being out of order is being hit by this panicky driver? But the driver, as he claimed, as he alleged, he said that the signal post was already out of order. That's why he hit the signal post, because he didn't see it in the dark night. To confirm the whole story, you need to have a time-by-time snapshots or maybe a CCTV video to confirm whether the signal post was working before 11 a.m. Only this is the method you can make sure that who is the culprit and who is not. In this picture, so in the previous picture, in this picture, the car and the signal post picture, the point I would like to make is here you have a risk factor, the green car. Here you have an outcome, an out of order signal post, but you cannot make sense that which one is the cause of which thing. The accident was occurred due to out of order signal post, or the car hit the signal post and made it out of order. So pictures may lie. So cross-sectional studies are just like pictures, a snapshot. That's why those cross-sectional studies are called snapshot studies. And in this picture, you can see that pictures may lie. There is a United Nations soldier, and in the background, that's written, or what's written? Involved in peace. That's a slogan of United Nations. But this United Nations soldier is at the wrong time in the in front of the wrong picture, which made the whole slogan very fun. Okay, so apparently this man is holding this aeroplane. This is just optical illusion. Pictures may lie. In this, the Katrina storm, it seems that the Statue of Liberty is causing that storm, but it's not. In this picture, you can see many women's, five women's running on the jogging track. What you can assess, or what you can conclude by this picture. Some people may conclude that all those who run on the jogging track, they become older. Or maybe the older people, they run on the jogging track. Or maybe those who run on the jogging track, they become obese or overweight. Or maybe those who are overweight or obese, they run on the jogging track. Because here, in this situation, in this picture, you just have a problem, maybe the overweight or obesity, and the outcome and the risk factor. So you cannot make sense out of this snapshot. In this picture, this is a snapshot of any college, any university. Some of the students are smoking, but we cannot say by looking just one picture that whether all of the students are smokers or not. So cross-sectional studies won't give you complete answers. They can give you answer at one point in time, but they cannot give you temporal relationship, the time-related relationship between cause and effect. So most of the time, cross-section studies are good for finding the prevalence, and they are known as surveys or snapshot studies, but are not good for making relationship and hypothesis testing. But cross-sectional studies can raise very good hypothesis, which you can later assess through some different study designs. So the advantages of cross-sectional studies are they are quick and they are relatively cheaper and they are easy to conduct, but the disadvantages are you cannot make temporal relationships and you cannot control different other risk factors which are playing their role in the relationship. So to answer that question that I posed you earlier regarding the a car hit the signal post or whether the signal post was already out of order, at 11 a.m. you can see the signal post is out of order and the car is just head on with the signal post. However, at 10 a.m. we can see the signal
Recording in progress.
Disease. All of those participants must be disease-free, which we want to study. At the beginning, we ask the participants, for example, the main risk factor is smoking. So we ask the participant, do you smoke? And on the basis of smoking-related questions, we classify them as smokers and non-smokers, or maybe we can make multiple groups: current smokers, ex-smokers, absolutely no smokers, or like that. Once we have formed the group, we follow them for a certain period of time. That certain period of time depends on the type of disease we are looking at. For example, if we are looking at cancers, so cancers may take years or decades to show up. So we have to follow them up for decades. For example, if we are looking at simply cough and coryza type of events or respiratory tract infections, so 1 year or maybe a couple of years follow-up would be feasible. So the length of the follow-up depends on the type of study we are looking at. The advantages of cohort studies, one of the most important advantages is the establishment of temporal relationship, because temporal relationship is the mainstay of making cause and effect relationship. And we can find incidence, the number of new cases in any cohort study, which we cannot find in cross-sectional studies or the other study that's called case control study. However, cohort studies are always not feasible for those diseases which are very rare. But cohort studies are good for rare risk factors, but not good for rare diseases. For rare diseases, you can choose case control design. So talking about the case control design. The case control design, as the name suggests, is having two groups, at least two groups. One is cases, the other is control. By case, we mean a group of people who already have developed disease, while the controls are those people, preferably similar age and sex, who are confirmed not having that disease or a similar disease. For example, we are looking at hypothyroidism, the risk factors of hypothyroidism, and we are selecting 18 to 40 years females. For some reasons, females only. So we will have one group of patients whose age would be 18 to 40 years, and all of those women will be hypothyroid, having laboratory confirmed TSH and FT3, FT4 levels, which are indicating that those women are hypothyroid. While the other group, that control group, will also be 18 to 40 years of age, but they will be laboratory confirmed not having hypothyroid, or in other words, they will be euthyroid. So in this sense, there would be two groups, cases and control, hypothyroid and euthyroid. Then we will ask relevant questions from those hypothyroid and euthyroid women. The questions may be about their diet, about their habits, about their drug intake, about their comorbidities, other diseases, about their family history, and anything that is relevant. So a case control study is very good study design for rare diseases. If you want to study rare diseases and find out the risk factor, do a case control study. But case control studies are not good for rare risk factors. Case control studies are relatively quicker than the cohort studies and better than the cross-sectional studies. However, and they have an inbuilt problem of recall bias, and they cannot establish temporal relationship or temporal sequence. The problem of recall bias can be overcome by triangulation or by making sure that multiple methods has been used to confirm the history given by the controls and the cases. When we ask someone, for example, if you ask this question from your own self, that what you ate on the last Wednesday afternoon, in the lunch last Wednesday, you may not remember that unless you are living in the hostel. There is a set menu, but otherwise you don't remember what you ate 1 week before, or 1 month before, or maybe 1 year. In the case control study, most of the time asking questions which are a decade older, history from the decade past. So that's a problem. Some people don't remember that remote history. So how do you choose the appropriate study design? It depends on your research question. If your question is, I want to find out how many people are affected by XYZ disease, your question is related to cross-sectional study. If you want to elaborate or describe the characteristic of patients who require ventilator support due to COVID-19 infection, that may be a case series. If you want to find out what are the long-term sequelae of COVID-19 patients once they are once they are recovered from COVID-19 infection, what are the long-term sequelae? So by long-term sequelae, you have to have a follow-up for 6 months or 1 year or maybe more. So in this question, you are telling the reader that you are following up the patient for at least 1 year or maybe more. So it depends how much time you have. If you have much time to follow up and to develop your study, you can do a cohort study. But if you are short of time, you can choose other study designs. But whenever you compromise on the type of design, you compromise on the quality of the findings. The other thing is resources. Time is resource, but other resources such as money, material, manpower, and your available methods. So these are the resources you should consider. Obviously, money is important. If you have to put in some 1 million rupees on a research person you want to study, do you have that much money? Even if you have that much money, is it wise to put that your personal money, out of pocket money, into the research person? Maybe or maybe not. It depends how big your question is. So I'll leave the rest of the 15-20 minutes for question answer. Let me confirm. Okay, right. So, all right. Okay. So due to some glitches and problems, the chat option is right now turned off, so I cannot take your questions on the chat, but you can always submit your queries to my email. My email is ashraf, ashraf dot jahangir, JAHANGEER @duhs.edu.pk. If you have a DHS account, I hope you have. So you just have to log into your DHS account, the email account, and type Ashraf, and my email will pop up there. So you can submit your questions there. And if you want some help in designing your own study, even if you are in the DIMC or DMC, I can help you designing your study. Just make sure that you have proper appointment with me so that I can spare time for you. वेटिंग रूम में कुछ है अभी भी लोग क्या? ये मेरे पास, अच्छा नहीं, ये कोई मैसेज आ रहा है मेरे पास. ओके, अच्छा, ओके, सही पुराना है, ठीक है, सही है. For those who are asking me to make groups for research, I can say that this is not my domain. I myself cannot make groups for research, and they will make your research groups and assign you. Not everyone will be under my supervision. Maybe a couple of groups, 1 or 2 groups will be under my supervision, and I'll conduct research and help them. But out of courtesy, if anyone else who want any help for designing their own research studies, they can contact me on email, or maybe they can come to my office once the COVID protocols are easy, right? So a quick recap of the thing that. So a quick recap is.
Yes. Okay.
A quick recap is we have different types of study designs. The descriptive study design and the analytical study design. Under the heading of descriptive study design, we have a case series type of study design in which we just have cases on which we can write detailed report to describe the features and the characteristics of those cases, but we cannot tell the reader that what was the prevalence or incidence or what was the denominator of those cases where they were coming from. And under the descriptive studies, there is another study design called cross-sectional studies, a very good, very quick, powerful, cheaper study design which you can conduct. But the problem with the disadvantage of cross-sectional studies are, although they are cheaper and quick, but they cannot establish relationship between cause and effect. You cannot make temporal relationship, and you can just generate hypothesis, but you cannot prove hypothesis using cross-sectional studies. So the other type of cross-sectional, other type of study design include cohort studies, in which you follow up the patients and other type of study is cohort study, in which you have a follow-up of patient, follow-up of group of participants or volunteers, and you look at the development of disease. Some of the cohort studies are called natural history disease studies, which were conducted years before, such as in the case of syphilis. You can study Tuskegee experiment on the internet, or in the recent times, in the COVID-19 scenario is one thing where we study this COVID-19 pandemic in its natural history form. So, but cohort studies require time commitment. If you don't have time, if you don't have time to follow up for the condition that you are looking at, you cannot conduct cohort studies. Most of the time, not always, but most of the time, cohort studies require money, material, and manpower, resources. So cohort studies are resource intensive. If you don't have, if you are short of resources, you may feel trouble conducting cohort studies. Cohort studies in the institutions where there is a very good computer databases available for patients and other hospital data. If you have a database available, you can conduct other type of cohort studies, which are commonly known as retrospective cohort study, or better say that historical cohort study. Those type of cohort studies, the one which are based on databases, they are relatively cheap, quick, and equally good as other type of cohort study. However, to conduct a retrospective cohort study or a historical cohort study, you must have an authentic and accurate database available. A database where you have information on the people, their condition, their disease, and their biomarkers, their lab values, their radiological findings, and the doctor's notes, maybe vaccination history as well. So on the basis of that, databases, you can conduct very good, quick, economical cohort study. So remember, cohort study is very good study design for rare risk factors, rare causes, but it is not a good study design for rare diseases. So for rare diseases, we have another type of design called case control study. In the case control study, we have at least two groups, cases and controls. Cases will be those people who already have developed the disease, for example, some cancer. Control will be those who have not developed the cancer, having similar age and sex, but not have the cancer. So in this situation, we will have two groups, cases and control, then we'll compare them for their habits and other characteristics. What made the cases to have cancer, we'll know once we compare it with the control's history. So as we can assume here, we can see case control studies are very quick, relatively quicker than the cohort study, and they are cheaper as well. But there is an inbuilt problem of recall bias. In the case control study, there is a problem of recall bias. Another type of design is experimental studies. As I told you in the beginning, the experimental studies, if you conduct them with the true spirit, must have three things enabled. Three things are randomization, random allocation of the treatment or vaccine or drug, whatever, to the two groups that you have formed in the beginning. Distribution of that treatment or vaccine to the two groups must be random, must not be based on personal biases, wishes, or patient's wishes. So a true experiment has three things: R, C, T. R stands for randomization that we just saw here. C stands for control group. So we must have a group who is not exposed to the treatment or the vaccine we are studying. And that group is not exposed, randomly not exposed, not by our wishes or our personal biases. So that random allocation is based on some computer programming softwares or some other methods which are manual, such as random number tables or random number generators. In the R, C, and T, the T stands for trial thing, the drug itself. The trial, in the experiment, the trial could be anything. The trial could be a drug or a vaccine. For example, for the COVID-19, we can see there was a trial of vaccine. We have given half of the group the vaccine and half of the group a placebo, an agent which has no pharmacological activity, and see that who developed the antibodies or who developed the disease or whatever the outcome. So in this manner, we can compare the exposed and non-exposed, exposed with the vaccine and not exposed with the vaccine. Instead of vaccine, we can use any other thing, drugs, therapeutic drugs, or some surgical technique, or some educational technique, or some other strategy to conduct the experiment. In case where we fail to establish the randomization, our study won't be a true experiment, but can be classified as half experiment or quasi-experiment. So this is all for this is the basics of study designs in epidemiology. And if you have any question, you can send me on email ashraf.jahangir@dhs.edu.pk, and I would love to answer your queries. Unfortunately, right now, the chat box is not enabled due to some reasons, so I cannot take your questions here. I hope you are clear about today's lectures, and wish you good luck. Dr. Maham, I have finished the lecture, and I can...
Shall we end the lecture?
I think it's time to.
Okay. Thank you, Dr. Ashok.
Thank you very much, Dr. Maham.